Right, so hello. So today we're doing a Profhilo treatment on Nikki, who is another aesthetics practitioner and I guess that is sometimes a student of mine.
Yes.
So we've marked her up already. So with Profhilo, you have 5 points to each side of the face that you inject. It's quite a prescriptive treatment, so it's quite set, no matter sort of like who you are or what you're wanting to achieve, because it's designed to basically give a bit of lift, but it's not a filler. So I'm just going to get some gauze. So I'll do this side first.
Yeah.
I've just realised.
So this is my second treatment. It's because I've already had one treatment.
Yeah. How did you find the first treatment?
All right, not too bad. I could tell straight away, really, within a couple of days.
Could you?
Yeah.
So if anyone has any questions, both myself and Nikki have had the Profhilo treatment, so we can talk to you about it. But then obviously you can also watch it to see what it's like.
Mm-hmm.
So, and as you know, it's quite a hard one to inject, isn't it?
It is, yeah, definitely.
So there's 5 points on each side of the face. These two are the most painful, so I always would rather go and get them ones done first, because then it's like plain sailing after that. So, are you ready?
Yes.
I'm going to do this one first. I think this one's the worst one. So, first one, shall I scratch? Right.
Yeah.
So after each injection, Nikki will be left with like a little bit of a ball, which on some points you can see, but like on the fattier parts of the face, like here, you won't necessarily see the ball as much, but when we do these ones out here where there's less fat on the face,
yeah, it's
a bit more obvious. My ones, I think, lasted for around, I don't know, I'd say they lasted about 10 to 12 hours after treatment. Do you remember how long yours lasted for?
No, well, I don't think it lasted that long, actually.
Oh, didn't they?
No.
Because you need to just leave them to disperse on their own, so...
I'm supposed to be going out for a meal tonight. I'll have all bumps.
People wonder what on earth you've been doing. I always think people just look at my face all the time now anyway, just because they're trying to figure out if I've had anything done or not.
You can feel that one going in more.
Do you think?
Yeah, I did, yeah.
This is the one on me where this one always lasts the longest, you know, like on the balls afterwards. But this one, like, gives a real lift, I think. I think that's probably, like, the injection I notice the most, if that makes sense. This one I never really feel. Alright.
Yep, lovely.
One more to do on this side. And I'm just going to change the needle so it's nice and sharp on the side. There we go. I don't know if you could see how much lifted your jaw looks just from that one. You won't be able to see it, but maybe.
Well, I can't, because I ain't got my glasses on either, so...
I'm conscious as well, my battery's quite low, so if we just disappear, it's because my battery's died. I didn't prepare Nikki for going live.
It's alright, darling.
Right, I'm just going to move this that way. I'm going to come round this side. So I'm going to start again on this one.
So it's very superficial, isn't it?
Yeah, like you just want the tip of the needle to only just disappear, really.
Yeah.
I don't think it's a particularly stingy injection. Like, you know how fillers are quite stingy because they have local anaesthetic in? I don't think this one necessarily stings. I think, but it made my skin feel quite tight.
Yeah.
Quite soon after. I'm just checking people can see. Is there anything you can do to lift eyebrows? Mine are droopy and really want them pulled up a bit. Yeah, there's a couple of things. So you can have like a brow lift. But it depends really where the droopiness is. If you want to send any photos at all so that I can have a look and make a recommendation, that's absolutely fine. Last one. There we go.
Thank you.
So that's the Profhilo treatment over and done with.
Yeah,
As you can
wow.
see. Hi Jay, you okay? As you can see, it's quite quick. Not really that painful either. There's like a tiny bit of bleeding, but it's not too bad. Nikki, do you mind if like you sit up and just show people?
Can you tell then that I've had it done straight away?
I'm just going to get a bit of arnica. Like I say, here you can kind of see the points there, and you can see this one down here on your jaw. But I don't really think, I don't know, I don't think it's that I think it's one of them treatments where once you've put your foundation on later, obviously you don't want to put makeup on straight away.
Yeah.
But once you put your foundation
so
on,
I will be alright to wear makeup tonight then, if I decide to.
I always say just leave it 6 hours once you've had an injection, before you put any makeup on. But yeah, that's it.
Thank you.
So it's more by the temple bit, the end of the brows. Yeah, that's quite easy to do, Amber. So if you want to send me a photo or anything, I'm more than happy to advise. Before my battery dies, does anyone have any questions? If not, I'll post this to my page so that people can keep watching it anyway. And Nikki, you might maybe share it on yours as well.
Yes, I will. Thank you.
All right, thanks everybody.
Thank you very much.
Bye.
Bye.